So we will discuss the second aspect, that's the staff or the personal aspects of community pharmacy. And we have to see that the medicines are kept in community pharmacies, including medicines, surgical items, and other healthcare items are kept in community pharmacies for making it available to the patients or their caregivers. So the medicines are such items which have to be handled with care, caution, and vigilance. Only people who are experts in handling with medicines, that means who were taught about, who were trained about, who have the previous experience in handling medicines, such people alone can be appointed in community pharmacies. And in the case of staff, we have to consider, we can even classify the staff into two categories. One is the pharmacy related people. That means the pharmacists, technicians, and other semi-skilled or that type of people will constitute the first category. And the second category will be unskilled workers like laborers and other people. So in the selection of staff for a community pharmacy, the pharmacist is an integral or essential part of a community pharmacy. And the basic principle of a community pharmacy says that the pharmacy should work only in the presence of, and it should start only with the presence of pharmacists in the establishment. We could see that after the selection of the location and building and space, the second part is very much important. That means a pharmacy can be started with staff, and that too, pharmacy professional or the pharmacists are the integral or the most important aspects of staff selection. Who is a pharmacist? Pharmacists are people who are educated, trained, and who were given proper license or authentication by the appropriate agencies like councils, government, and other departments. So only a registered pharmacist means a pharmacist who studied the subject of pharmacy and who is competent or qualified enough to become registered. They alone are registered, and such registered pharmacists are competent to manage the activities of a community pharmacy. So in the case of staff, the number one aspect is the pharmacist, and that too a registered, educated, competent pharmacist should be there. And what is the need of these pharmacists? The pharmacists have to receive the prescriptions. He has to supervise the dispensing of the medicines as per the prescriptions. At the same time, the patient or his caregiver has to be educated or has to be informed about how to take the medicines. So medicines are unlike other commercial items or even compared to food items. Medicines are items which has to be taken properly and in the specified manner. And such information can be given only by qualified people like pharmacists. So in the case of second aspect of the management of pharmacy, staff is an integral part, and among the staff, pharmacists are the most important people there. So apart from the registered pharmacists, quite often the pharmacist may need or they require the help of other people who are not so much trained or educated like the pharmacist, but competent enough to help the pharmacists under their supervision. Such people, we call them pharmacy technicians. So pharmacy related people means two categories we can call them. One is registered pharmacists or qualified pharmacists. Second, technicians or skilled people who can help the pharmacists in performing the duties perfectly. And apart from this pharmacy related personnel, we can have the other category called non-skilled or unskilled category of people. That means quite often they are used for opening the cartons or cleaning certain containers, vessels, etc.